Thank you, Mr. Speaker. I've spoken in this legislature numerous times about the need to empower our frontline healthcare workers. Paramedics and nurse practitioners are highly talented and well educated about providing appropriate care, but they're denied the authority to make decisions well within their expertise without the supervision of a doctor. This prevents them from using their best judgment about who does and who doesn't need acute emergency medical treatment, and allowing these professionals more flexibility will lead to shorter emergency wait times and better patient outcomes for Albertans and save money. To the Minister of Health, when will you allow these qualified medical professionals to practice to their full scope of abilities?
Honourable Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the important question. I was very proud to work to make sure that we brought paramedics under the Health Professions Act, something that I know paramedics have been waiting many, many years for under previous governments, and that was something that I think moved us along that path. And we recently, just a couple of weeks ago, expanded the community paramedicine program again to ensure that paramedics are working as close to where patients are, and the ability to not be seen as experts who are there to transfer, but experts who are there to also deliver exceptional frontline care, Mr. Speaker. And we continue to work with registered nurses, licensed practical nurses, and other allied health professionals to ensure that we are finding ways to move forward and supporting their scope of practice.
Thank you, Honourable Minister. For supplemental.
Allowing for more discretion in treatment options are important, and we want to get people out of the emergency departments. It's equally important that they be given the appropriate resources to do their jobs. Under this government, EMS funding has been unreliable at best. Recent increases barely covered the last NDP cuts to EMS funding, and to make matters worse, call volume is an all-time high. With the next provincial budget coming out this week, EMS are understandably nervous about the direction that this government is headed. To the same minister, will you finally commit to the level of funding that EMS needs and to properly do their job, or can they expect more surprise cuts?
The Honourable Minister.
Mr. Speaker, thank you so much for the question. Under the former government, of which the member was a member and his new leader was the health minister, right before the last election, they were proposing $1 billion of cuts to health care, which we know would have impacted frontline EMS workers, Mr. Speaker. What we've been able to do is to reverse those cuts, provide stable, reliable growth to Alberta Health Services and their budget in turn, and ensure that we have abilities to make sure that while numbers are up, certainly response times aren't, and we look forward to being able to present the budget next or later this week, Mr. Speaker, and I look forward to finding out if the member will stand with frontline paramedics or sit with the official opposition in cuts.
Thank you, Honourable Member. Second supplemental.
Mr. Speaker, this minister should tell the truth. Those cuts were to management and not frontline staff. Minister, I get it. Your health care is complex and you have a difficult job. However, you have the power to make improvements immediately. I'm hearing from paramedics that their situations are getting worse. Long waits in hospitals, not enough ambulances, putting more strain on our EMS workers. Since you have the ability to resolve both of these issues, and in fact, we're talking about this again, is troubling to say the least. Minister, you're the final authority on health care. You need to take responsibility and fix these things. Will you take responsibility and will you fix it?
The Honourable Minister.
Thank you so much, Mr. Speaker. I'm so proud to have the responsibility to reverse the cuts that were coming from the member opposite and his then government. Mr. Speaker, you couldn't find $1 billion worth of cuts if you fired every manager all across Western Canada, Mr. Speaker. This would have had devastating impacts to the people of Alberta. The people of Alberta spoke up, and they made sure that they elected a government that would protect frontline care, protect their workers, and I'm proud to do just that and find ways to improve it at the same time, Mr. Speaker. We are doing it. We're proud to have government, and feel free to continue to sit with the opposition for deep cuts instead of standing with the front lines that you used to serve with.